Hi, I'm Dr. Nemechek. This is one of our video blogs. I want to talk to you today about lightheadedness, sometimes referred to as dizziness, and how this contributes to headaches and fatigue and some other symptoms. One of the major things your autonomic nervous system has to do in the daytime is to drive blood pressure up to the top of your head, okay? And it's a big challenge. You're having to wrestle with gravity all day long because that gravity's trying to drive blood from your head to your feet. And this is one of the first and most common types of symptoms that you're going to see with autonomic dysfunction. A very common thing that people will notice is lightheadedness. They get out of bed or they stand up out of a chair and suddenly they feel this kind of woozy, dizzy kind of symptoms. And what happens is the autonomic system is not capable of adequately pushing up against gravity to get that proper pressure in your brain so the oxygen can go from a red blood cell into your brain. Excuse me. You only have 1 second of extra oxygen in the brain, okay? So when you stand up and you feel those symptoms, what in fact is happening is your blood pressure goes, whoom, drops like that, all right? Now it doesn't return to normal. You still have low pressure, it's just not quite as noticeable, but now you're feeling symptoms such as, I'm just tired, for no reason. I slept well, I'm really tired, your blood work is fine. It's a very common cause of chronic fatigue in people. This is also the cause of ADD, where you can't generate enough oxygen in the brain and you can't focus, you can't concentrate, all right? Now, not only the brain doesn't get oxygen, but the scalp and neck muscles don't get oxygen. Muscle without oxygen is very painful, all right? Ask anybody who's had trouble with their heart when they've had a narrowed artery. It's called angina. It's a very painful problem. And, and in the neck, these triangular muscles here, we call it coat hanger pain. It's from lack of oxygen in the muscle. It tends to be worse when you're sitting still and better when you're active, because when you move muscles, it generates blood pressure up into your head and neck. And the majority of headaches are from this low blood pressure problem. An exception would be the headaches that are really kind of more in the frontal area. Those often tend to be sinus headaches. Also, these headaches tend to be better when somebody's laying down. So maybe you wake up first thing in the morning and you don't have a headache, but after you get upright for maybe 30 minutes or an hour or two, you can feel your headache coming on. It's from the low blood pressure. Now, the brain doesn't like this. And instead of it being a nuisance, actually, the brain thinks you're going to die, okay? It is a very strong problem, very strong signals from the brain to deal with this. So this will make people crave salt and sugar. The brain knows and learns that salt and sugar intake will boost pressure up to your head, all right? You may get really thirsty. The brain learns that if you flood the body with water or some liquid, you'll boost blood pressure to your head. The brain will learn that fidgeting, tapping your feet, so these people are tap, or they're wiggling constantly in their chair, that muscle movement will drive blood pressure to your head. That's why the neck pain gets better when you're active, okay? Nicotine drives blood pressure to your head. So the old-fashioned pack-a-day smoker, every cigarette, boosh, drives blood pressure to your head. That person doesn't have a nicotine problem. They actually have a gravity problem. Because when they go to bed, they lay flat, voila. Suddenly, they don't need a cigarette for 8 to 10 hours. Till they wake up in the morning, you gotta have a cigarette, okay? And then finally, if you aren't eating or drinking or fidgeting or using tobacco or maybe even ADD meds, they drive blood pressure to your head. All these things are trying to fix this problem. Your body releases a hormone called noradrenaline. This is your fight or flight hormone. It can make you angry, it can make you grumpy, it can make you anxious, it can make you panicky. And it's being released not because you're in some life-threatening situations, for instance, like somebody's trying to steal your money with a gun, okay, you'll release noradrenaline. That's why you get all nervous. Noradrenaline is being released because noradrenaline boost blood pressure to your head. But now you may be just sitting in an Italian restaurant and you're just starting to freak out, and suddenly you're like, we got to get out of here. And even though part of your brain says everything's fine, I must be a little crazy, it's because you don't have proper oxygen in your brain. And this is a very, very typical sign of autonomic dysfunction. So I hope you found this video helpful. There'll be more to come. Y'all have a good day. Take care now. Bye-bye.